welcome to Word of Mouth, the talk show where we talk about the mouth and all things that affect the mouth. I'm your host, Lori, and here's my co-host, Yenna. Say hi, Yenna. Good girl. So today we're going to be talking about chemotherapy and its effects on the mouth and the teeth in general. Before we begin, it's important to know what chemotherapy is, and chemotherapy is the treatment that cancer patients undergo to shrink the size of the cancer cells. Unfortunately, chemotherapy also affects and attacks healthy cells, causing a multitude of complications, and we'll talk all about those today. There are a multitude of drugs used to treat cancer. Some of those include cisplatin, carboplatin, and paclitaxel, but the list goes on, and often different drugs will be mixed depending on the cancer being targeted. Some of the side effects from the chemotherapy treatment include mouth sores, peeling of the tongue, changes in taste, bleeding, sensitive and inflamed gums, and brittle teeth that can be cracked or split. There's also a chance that young children receiving chemotherapy treatment, if they're under the age of 5 and their permanent teeth have not been formed yet, those teeth can come out misshaped, deformed, or not be formed at all. And in cases like that, they would have to look into the use of a denture. Another major side effect of chemotherapy on the oral cavity is xerostomia, also known as dry mouth. This is because some chemotherapy drugs affect the salivary glands, causing a decreased production of saliva. This is really bad for the teeth and the mouth in general because saliva plays a huge role in the overall health of the oral cavity. Saliva aids in the pH balance of our mouths. So, for example, somebody who has an imbalance of the pH level in their mouth might get thrush, which is a yeast infection in their mouth. It aids in the mechanical cleansing of our teeth. Basically, it helps to keep our teeth surfaces a lot cleaner because when they're dry, plaque gets stuck to them. And when there's more plaque, there is an increased chance of gingivitis, which is gum disease, and increased chance of cavities on our teeth because there's more bacteria there. While undergoing cancer treatment, it is recommended that you go visit a dentist and keep the dentist involved in your treatment course so they can do checkups and just make sure that everything inside your mouth is as healthy as it can be given the circumstances. Also, the use of a saliva substitute can aid in dry mouth and avoid the complications that come alongside with dry mouth. So that would be a really good idea, really helpful, and to keep the pH balance in the mouth healthy and to keep thrush away, those kinds of things. For blisters and sores that can come in the mouth, those are really painful, but doing a saltwater rinse with the ratio of 1/4 teaspoon of salt to 1 cup of distilled water and gargling that for about 45 seconds can help heal those sores up and make sure they're staying clean and free of infection. Brushing with a soft bristle brush is really important. You want to make sure that you're taking off that plaque and that bacteria in the mouth, especially if dry mouth is occurring. There's a buildup of plaque, and we know what happens with dry mouth. We want to avoid that at all costs. And like I mentioned earlier, it's really important to keep flossing and to keep those interproximals clean to avoid any cavities, even if it's painful. Thanks for tuning into this week's episode of Word of Mouth. Join us next week where our topic will be, should you let your dog kiss you on the mouth? Shh, save it for next week, Anna. Bye.